But this is not the only study that has recently shown some concern about refined carbohydrates. In 2017, the Lancet published the PURE study, another really massive 18-country study with 135,000 people aged 35 to 70. And they followed people for 7.4 years. And what you can see is that if you ate less fat, it was not associated with better heart disease. In fact, eating more fat was associated with both less deaths and less heart disease. So cutting down the fat may not have any benefits for heart disease, which was of course what the original 1977 dietary guidelines was based on, cutting heart disease. But it doesn't seem like there's any good reason to think that's true. Eating more fat might even be better for you. And that was what people used to call the French paradox. When I was in medical school in the 1990s, the Americans were eating low fat, the French were eating all their butter and cream. And we thought it was a paradox. How can they be eating so much fat and not getting heart attacks? And the answer was, well, it wasn't a paradox. The dietary fat just didn't play a huge role in the causation of heart disease. In fact, those people who started to eat more fat, such as with the Mediterranean diet, actually did much better. And also look at the carbohydrate intake. What you see is that if you increase the carbs to very high levels, that is associated with increased death and increased heart disease. But keep in mind that at the very right of this graph, you're looking at extremely high carbohydrate intakes above the 60% recommended by the dietary guidelines, so this may or may not apply. Nevertheless, there doesn't seem to be a huge reason to be advocating for a super high carbohydrate intake because it may cause weight gain. And of course, that is actually precisely what we did see in the obesity epidemic. So the bottom line is this: foods are not just a slurry of macros. It's more than just the carbs versus the proteins versus the fat. There's all sorts of different things that go into how this affects your body. What you want to do is try to cut down those refined carbohydrates, the white bread and the rice and the potatoes, particularly the French fries, for example, and try to eat more fibrous food. Try to eat more non-starchy vegetables, and eating more natural fats also doesn't seem to be causative of heart disease. So those are some important takeaways from the recent huge trials that have been done.